The Rising Tide, Understanding Drug Addiction in America. Today we're diving into a topic that's affecting millions of families across America. Drug addiction and why it keeps getting worse. Now I know this isn't the lightest subject, but stick with me because understanding what's really happening is the first step toward making a difference. So let's talk numbers for a second. In 2023 alone, over 107,000 Americans died from drug overdoses. That's like losing the entire population of a small city every single year. And here's the kicker. This number has been climbing steadily for decades. We're not just talking about a problem anymore. We're talking about a full-blown crisis. But how did we get here? Well, the story starts way back in the 1990s with something you've probably heard about, the opioid epidemic. Pharmaceutical companies convinced doctors that new pain medications weren't addictive. Spoiler alert, they absolutely were. Pills like OxyContin flooded into communities, and suddenly, suburban moms, construction workers, and college kids were all getting hooked on prescription painkillers. When doctors finally started cracking down on prescriptions around 2010, addicted people didn't just stop using. They turned to cheaper alternatives on the street. Heroin use skyrocketed. And just when we thought it couldn't get worse, synthetic opioids like fentanyl entered the picture. Now, fentanyl is where things get really scary. This stuff is 50 times stronger than heroin and 100 times stronger than morphine. It's so potent that an amount smaller than a few grains of salt can be lethal. Drug dealers started mixing it into everything: heroin, fake prescription pills, even cocaine and meth, often without users knowing. Why? Because it's cheap to produce and incredibly addictive, but it's also incredibly deadly. Between 2019 and 2023, fentanyl-related deaths absolutely exploded. We went from around 36,000 deaths to over 75,000 deaths annually. Think about that for a moment. That's more than double in just 4 years. The drug supply has become like Russian roulette. You literally don't know what you're getting anymore. But it's not just opioids we need to worry about. Methamphetamine use has been quietly surging too. While everyone was focused on the opioid crisis, meth made a comeback with a vengeance. Today's meth is also way more potent than what was around in the early 2000s, and it's causing devastating effects on users' mental and physical health. And let's not forget about cocaine and newer synthetic drugs that keep popping up. The thing is, the addiction landscape is constantly evolving. As soon as law enforcement figures out how to combat one drug, another variation appears. So what's driving all of this? Why can't we seem to get ahead of this problem? First off, there's the economic factor. Drug trafficking is a multi-billion-dollar business. Criminal organizations are constantly innovating to maximize profits. Fentanyl is the perfect example. It's cheap to make, easy to transport because you need such small amounts, and it hooks people fast. Then there's the social side. Many people struggling with addiction also face mental health issues, poverty, unemployment, or trauma. Drugs become a way to cope with pain that feels unbearable. The pandemic made this way worse. Isolation, job losses, and anxiety sent substance abuse rates soaring. Deaths spiked dramatically in 2020 and 2021. We also have to talk about stigma. Despite addiction being recognized as a medical disease by every major health organization, people still treat it like a moral failing. This shame prevents people from seeking help until it's too late. And even when they want help, treatment facilities are often overcrowded, expensive, or just not available in their area. Let me give you some perspective from different parts of the country. Take Hawaii, for example. You'd think a tropical paradise would be immune to these problems, right? Wrong. Hawaii has been dealing with a serious meth crisis complicated by its geographic isolation. Getting treatment resources to the islands is challenging, and many residents struggle to afford rehab on the mainland. On the flip side, Vermont, this small rural state, has actually become a model for how to address addiction. They've implemented harm reduction strategies like needle exchanges and increased access to medication-assisted treatment. Vermont treats addiction as a public health crisis rather than just a criminal justice issue. And while they still face challenges, they've seen some promising results in stabilizing overdose rates. The truth is, what works in one place might not work everywhere. Urban areas deal with different challenges than rural communities. Cities might have more treatment centers, but they also have more potent drug markets. Rural areas might have tighter-knit communities, but they often lack medical resources, and people have to travel hours for treatment. So what can we actually do about all this? First, we need to expand access to treatment. Medication-assisted treatment using drugs like methadone, buprenorphine, and naltrexone has been proven to work. These medications help reduce cravings and withdrawal symptoms, giving people a fighting chance at recovery. But too many places don't offer these options or make them too difficult to access. Second, harm reduction saves lives. Things like naloxone distribution, that's the overdose reversal drug, supervised consumption sites, and fentanyl test strips don't encourage drug use. They keep people alive long enough to get help. Dead people can't recover. Third, we've got to address the root causes. Better mental health services, job training programs, affordable housing. These things matter. You can't expect someone to stay sober when they're homeless and hopeless. And finally, we need to change the conversation. Addiction isn't about weak people making bad choices. It's a complex disease that changes brain chemistry. When we treat people with compassion instead of judgment, recovery becomes possible. Look, I know this has been heavy, but here's the thing. There is hope. Millions of people are in recovery right now, living healthy, productive lives. Recovery is possible, but we've got to do better as a society. We've got to demand better policies, support better funding for treatment, and show more compassion for people who are struggling. If you or someone you know is dealing with addiction, please reach out for help. The Substance Abuse and Mental Health Services Administration has a national helpline at 1-800-662-HELP. It's free, confidential, and available 24/7. All right, everyone, that's it for today. If you found this video informative, please give it a thumbs up and subscribe for more content. Drop a comment below with your thoughts. Have you been affected by the addiction crisis? What solutions do you think would work? Let's keep this conversation going because silence isn't helping anyone. Thanks for watching, and I'll see you in the next video. Take care of yourselves and each other.